Welcome to the 613 Seconds podcast powered by the Jewish Life Network. Hi, I'm Aaron Friedman, your host, bringing you insightful, unscripted conversations with personalities connected to Baltimore's Jewish community, leaders, thinkers, and influencers who inspire and shape Jewish life. In just about 613 seconds, you'll gain wisdom, perspective, and connection because every second counts. Now, let's dive into this episode of 613 Seconds. Welcome to another episode of the 613 Seconds powered by the Jewish Life Network. Today we have with us Dr. Elie Miller from Baltimore, a well-known doctor. Thanks for joining us, Elie.
Thanks for having me on board. Good to be here.
Yeah, amazing to have you here. So maybe introduce yourself to the community for those that may not know you. Where are you from originally?
Sure. So I grew up in Boston, Massachusetts, or Brookline, Massachusetts to be exact, but with very strong, deep family roots in Baltimore. My mother is from here. In fact, my children are going to be seventh generation of our family and consecutive here in Baltimore. So grew up in Boston myself, attended Masifta of Boston for high school yeshiva education, eventually ended up in the Mir Yeshiva in Jerusalem, where I first discovered that I should be considering medicine. It was something that I really encountered in Israel for the first time in Jerusalem.
Mm-hmm. So what was that in Israel that created that spark?
Well, I was in yeshiva in Namir, encountered an opportunity to volunteer for Magen David Adom, working for the state of Israel in their ambulance service or EMS volunteer service. And that's something that I've continued that connection to this day. I have actually worked as a physician for Magen David Adom as well. So what started out as volunteering as an EMT has really come a long way down the road. And it was while I was doing that in my spare time in between classes in yeshiva that I started to think about, hey, do I want a future in this? Is medicine something that I want to devote the rest of my life to?
Is that something that's in your family already, medicine, or is this just something that was always pulling at you?
So it's a good question, and I think everybody always assumes if you're a physician, you must have had a lot of physicians in the family. And the truth is I do have a few. I have an uncle, Dr. Bulmash, who's a renowned pediatrician. I have a brother-in-law, Dr. Feldman, also a pediatrician. I have a grandfather, also Dr. Bulmash. I went to dental school and medical school here at University of Maryland. So the healthcare representation in my family is there. At the same time, I would say possibly more attorneys than physicians.
Okay, so following the Mir, where did you go from there?
So after I was in the Mir, I found a great opportunity right here in Baltimore, Maryland. And it wasn't with the intention of, hey, let's settle in Baltimore for the rest of my life. And I think I'll circle back to that about kind of what draws me here, or what drew me here. But the intention was, hey, there's a yeshiva here. I can stay in yeshiva. I can continue to learn. And I can complete a pre-med post-bac program through Ner Yisrael. So I did that. Ner Yisrael had a pre-med, pre-dental, pre-pharmaceutical program through Towson University. And I studied in Ner Yisrael during the day and completed that in my first few years in Baltimore at night.
Got it. So how many years were you in Ner Yisrael?
Oh, that's a tough one. I think officially 2009, I came here and was probably there for about 1 year single and 3 years married. So I guess 4 years.
Yeah. So which medical school did you go to following your schooling in Towson? Is that
so Towson by way of Ner Yisrael. During my gap year, typically taken off while you're applying to medical school, I actually had a research position at Johns Hopkins within the interventional radiology department and actually published some work there with them. It was a great honor to be working with that team there, really a tremendous privilege. From there, I went to University of Maryland School of Medicine and was once again very fortunate. I think it's unusual to be able to stay in one place throughout your medical training. And once again, wasn't my intention that, everything has to be here in Baltimore. But to have ended up here for pre-med here, research here, medical school, and then eventually residency here was a great thing. And being in medical school locally was an opportunity to both get to know the city better and get to know the community better. And that relationship with the community really continued to grow over time. So while I was getting to know the medical school in my class, and I was serving as a president of my medical school class, I was also already serving as a gabbai in my shul and starting to get to know the shuls better and the people better.
Which shul was that in Baltimore?
Back then, I was living in Pickwick. That was at Rabbi Weiss's shul. I feel like all of us started there, right? But I still feel very close to Rabbi Weiss. And many of the people that I davened with there, I still daven with now, even though we live in other parts of town. So
it's amazing. So it seems like medical research seems to have been a big part of your background and your education. So what is that about?
Good question. I entered medicine at a time when research had gone from being something that was almost like a bonus if you had a physician who was into research to something that in a good academic school was expected. By the time I was at University of Maryland, literally while I was in school, they actually made it mandatory. It went from just being something to encourage to something that was understood to be done to then mandatory programs for research. While I was in medical school, the research path that I chose was in pediatric orthopedic surgery, a couple of specific highly nuanced surgeries that I helped do some research in. And then in residency, a very similar theme, a very academic residency position at University of Maryland, and did research in medical school academics and residency academics and education, and actually won the Resident Researcher of the Year award while I was in University of Maryland in my final year there of training. So that was pretty exciting. And I think in day-to-day practice, while I don't do a tremendous amount of research right now, it allows me to keep up with the medical students. I do teach students at Johns Hopkins and at University of Maryland. Anybody that walks into my practice, you may or may not encounter some students there, though you never have to see them. But I enjoy the teaching, and being familiar with the research plays a role in that. But being familiar with the questions that your patients are going to ask, because the patients will ask questions. It's 2025. They see the articles. They see the headlines. They see the research news. They want somebody that can walk them through that can help interpret it, that can help it become meaningful for them.
Got it. So you opened up your practice, which is called Apex Concierge Health. Was that your first, like right away, right out of college, you opened this practice up, or were you working somewhere else first? What was that like?
So while I was in medical school, I really entirely coincidentally bumped into somebody by the name of Kevin Ferentz. He's actually a very renowned local family medicine physician. And at the time, I wasn't even certain about family medicine. It wasn't quite on my radar yet, but I met him, and he actually said to me at the end of a month working with him, he said, "You can go do whatever you want, but just know you're becoming a family medicine doctor." And I said, wow, this guy's crazy, because that's not what I was planning on doing. But on the other hand, he's been teaching medical students since before I was born, so I think he was on to something there. And a year or two later, I turned back to him and I said, "Hey, I'm going into family medicine." He said, "Yeah, I knew you were going to do that." And then the next sentence was, "And you're going to come work with me at GBMC." So once again, the prophecy was perhaps self-fulfilling, but I ended up at GBMC right out of residency. I was there for about 4 years, working side by side with Dr. Kevin Ferentz, Kevin Carter, and a number of other people who all either trained at University of Maryland or were very involved with the academic side of the family medicine department there. After about 4 years there, made the decision that I wanted to have my own practice, and I wanted to be able to design something that was geared directly for the greater Pikesville community, the greater Pikesville community, both within the Orthodox community and outside of the Orthodox community. So really that something that could reach in every direction and speak to everybody, and really be tailored for the unique nature of the neighborhoods that we live in. I left GBMC on wonderful terms. I'm actually still on staff there, and still in touch with all the doctors, including the specialists that I've worked alongside.
It's amazing. It's impressive. And I guess what I'm wondering is, the name of your practice is Apex Concierge Health. So the name concierge, what is that looking to imply? It sounds like there's something special about your practice or different about your practice.
So I think concierge is a great word. It's also a risky word. And when I started the practice, I thought about actually taking that name out. I think that when people consider what is concierge medicine, the few or the perhaps many that are familiar with it have a lot of other words for it. And words that I hear get thrown at me. They say, "Oh, is this Gucci medicine? Is this VIP medicine? Is this rich person medicine?" And There's an element of the word concierge that I want to retain and an element that I want to reject. The element that I want to retain is that this is deeply personalized. There is an element of a fee for service. There is an element of your doctor will have an hour to spend with you. You will be able to get everything out there. You will not be rushed. You will not wait on hold for 60 minutes. Your medications will not be sent to the wrong pharmacy. All similar types of problems we've all encountered in modern healthcare. The part that I would reject emphatically is that, like I said, this is concierge represents some sort of bougie or must be rich idea. It's not that. This is for the community. This is something that can and should be available to anybody. We live in an era where healthcare is changing. Healthcare is frustrating. Healthcare is frustrating for patients, but what patients may not realize is healthcare is frustrating for physicians also. And that leads to a sense of burnout in all directions. And concierge medicine or tailored medicine made directly for a community, made to accommodate the needs of the patient and the physician, is the solution that's continuing to emerge everywhere you look.
What is it that you love about Baltimore?
This community gives it its all to everyone at all times. It's amazing. It's just amazing how integrated we are, how open we are, how willing to help we are. I can't think of a time where I've ever hit a blocked door, a brick wall for something that was needed for somebody in our community. So we have a beautiful thing going here in Baltimore on an organizational level, on a robustness level, on a schooling level. I know everybody always has a lot to say about all of our different institutions, but I can really say from the bottom of my heart that being in Baltimore has been an incredible experience and one that my wife and I are very, very pleased with.
That's amazing. Now, if you don't mind sharing, how would somebody get in touch with you if they're interested in perhaps booking an appointment or learning more about the practice?
Sure. Easiest way is just hop on our website. Our website is apexchm.com. CHM stands for Concierge Health Management. So again, apexchm.com. You'll be able to link right in with us. And people can always be in touch with me directly via my cell as well, 617-990-4197. People know where to find me, and if you don't, now you do.
Hey, not everybody gives out their cell phone, but that's I guess that shows how willing you are to actually help people. It's impressive.
Yeah, that's an Apex brand. I mean, if you can't be in touch directly with your doctor, like it was in the good old days, then you need to be you need to be looking for where you can be. So.
Well, thanks for joining, and thank you so much for everything that you do for the health of the Baltimore community.
Thank you.
Thank you so much.